Listen, remember, I'm here not just as a governor, but a father. This is what I want for my family. And of course, I want that for every family in Pennsylvania as well. In just a few moments, I'm going to sign an executive order here at CHOP directing Pennsylvania state agencies to take additional steps to protect access to vaccines here in our Commonwealth and ensure that Pennsylvanians have reliable information available to them so they can make smart decisions. This executive order, which I'm about to sign, goes through 6 concrete steps. I'd like to walk through them briefly with you. First, I'll be directing Dr. Deb Bogan, who leads our Department of Health, to create a Pennsylvania-based program similar to the federal Vaccines for Children, which provides free vaccines for up to 1.5 million Pennsylvania children. So as I think you know, the access to vaccines through the federal program is based on ACIP's recommendations. And I know we're all worried about RFK's handpicked folks on ACIP imposing further restrictions on vaccines that have long been proven safe and life-saving for our kids in the months to come. So we are preparing right now. And should that happen, we will have a Pennsylvania program in place in order to protect all God's children. Second, I'm directing all Commonwealth agencies to ensure our state regulations and guidance align with the recommendations of our nation's leading medical experts. We want Pennsylvanians to have reliable evidence-based information regardless of what happens at the federal level. Third, to that end, I'm also directing the Department of Health to create a central hub of vaccine information and resources, which is housed at pa.gov/vaccines, so folks have one clear place here in Pennsylvania to go to for actual facts, for actual science, and for answers. That website is now live, and it will be updated regularly as the Commonwealth takes additional steps. Fourth, I'm directing the Department of Human Services under someone I know you know well, who's a dear friend and doing an amazing job as a member of my cabinet. The head of the Department of Human Services, Secretary Val Arkush, Dr. Secretary Val Arkush is here. I directed her together with our insurance commissioner, Mike Humphreys, who joins us here today. Thank you for being with us, Mike, to make sure that all FDA-approved vaccines remain covered by Medicaid and private insurance here in our Commonwealth. I want to thank Commissioner Humphreys, who has already been in touch with private insurers across the Commonwealth, and they have committed to Commissioner Humphreys and to my administration that these private insurers will continue to cover these vaccines at least through the end of 2026. I know that's been hard work, and we appreciate all your work with the private insurers. Fifth, I'm directing the Department of State, under the leadership of Secretary Al Schmidt, the Department of Education, and the Department of Aging, to clearly communicate our updated vaccine guidance to schools and senior centers and professional licensing boards to once again empower Pennsylvanians with actual facts, real science, and the information they need to make smart healthcare decisions. And sixth and finally, I'm directing the Department of Health to convene a new working group of pediatricians, family physicians, obstetricians, parents, pharmacists, public health experts, local leaders, and community representatives to develop a strategy for communicating publicly around vaccines, to clear up the misinformation and disinformation and provide real information to Pennsylvanians. At the same time, Dr. Bogan and her team will continue to work closely with our local health departments and our neighboring states through the Northeast Public Health Collaborative, which I've joined with other governors here in the northeastern part of the United States, to ensure that vaccine guidance is consistent across this Commonwealth and across our region. We'll be making it clear that here in Pennsylvania, we're following real facts, we're applying real science, and we're going to give Pennsylvanians the freedom to make their own informed healthcare decisions, and that we expect our insurance companies to follow suit. In the absence of clear and common sense guidance at the federal level, I want you to know my team and I are stepping up here in Pennsylvania.